Mason General Hospital and Family of Clinics was recently accredited as the first Washington hospital and one of the first in the nation to receive national recognition as an acute stroke-ready hospital. What does that mean? The hospital's Chief Operations Officer, Eileen Branscombe, explains.
It's an important designation by the Joint Commission, which is a nationally recognized agency that certifies hospitals and does certify specific disease certifications like acute stroke ready. We've been partnering with our tertiary partner, Providence St. Pete Hospital, since 2008.
The hospital acquired new technology so it could achieve disease-specific care certification. Hospitals that earn that certification must be equipped to treat stroke patients with timely evidence-based care prior to transferring them to a primary or comprehensive stroke center.
For stroke, early identification and early intervention is key in saving and preserving brain.
And Branscombe says when you save brain, you can prevent the symptoms of a full stroke, such as facial, arm or leg numbness or paralysis, sudden confusion, double vision, and severe headaches.
We're kind of like the glue that links the primary and the specialist together, harnessing the power of technology with this device called a robot, where the neurologist can actually see, as Sabrina said, the size of the pupils. They can see what the ED docs here see. So the benefits to our community, it allows them to receive those sophisticated services in their local community and be assured and reassured that we've got a strong partner, with a full-blown stroke program. If they need surgical intervention, we don't do that here, but Providence St. Pete does do that. So the neurologist really provides care via the use of this technology in concert with our emergency department physicians, which really fits in with our mission why we're here.
Sabrina Nelson, Director of Emergency and Trauma Services at Mason General, says the staff has been trained for the program.
So it's all throughout the hospital now. That's part of the Acute Stroke Ready program. We have every nurse is trained, every CNA, monitor tech is trained to recognize stroke symptoms, and we're doing more to also educate the community. Time is brain, and 85% of strokes are called acute ischemic strokes, or they're like small blood clots, and these are treatable by medication in a lot of cases. And so, but it has to be within a 4-hour window of when symptoms start. You only have so much of an opportunity to use this medication. So we want to make sure that patients understand that, community understands that, call 911, get the help you need, get evaluated by a physician.
Nelson explained the chain of events that take place before and after emergency 911 is called and the patient is transported by ambulance to the hospital.
EMS will call us on the base station phone. I have a code stroke in progress. Here's the vital signs. They give us the report as they're coming in. We're 5 minutes out, we're 15 minutes out, whatever it might be. And then we notify, we call a code stroke in the hospital. So DI readies the table in case they're in the middle of, someone that has an appointment. They clear the table. Lab is aware, so they're right there. Respiratory therapy in case there's any breathing problems. Everyone reports to the ER, ready for the patient. Patient comes in. The doctor quickly evaluates at the door on entry. An RN and the doctor come down to the suite. Labs are drawn so we can get the blood work started, and the patient's on the table and the CT is done. The doctor makes sure and looks at the images right away to make sure there's no head bleed. If there's a bleed, you cannot give this medication that can reverse a stroke. The neurologist then says, no, this is an obviously stroke and this is what you need to do. Yes, I'm in agreement, and yes, I'll accept the patient, or let me evaluate the patient and talk with the family about using Activase or TPA.
Once the CAT scan is administered, the patient's 3D X-ray images are produced for a doctor's review. The blood clot that caused the stroke can be seen, for example. I'm Jeff Chu for iFiber1 News.
That is the clot she had.